Today is Tuesday, April 14th. This is VOA's International Edition. I'm Lori Lunden in Washington. Amid the pandemic, a deadly storm rolls through the southern U.S. The head of our agency addresses unfounded attacks on Voice of America's coverage of the pandemic.
We are 100% government funded. We are not government controlled.
Also ahead, rapper Pitbull is using his music to lift up fans in the lockdown. It's all on today's International Edition. A top health official in the U.S. said Monday that the coronavirus outbreak could reach its peak here this week, pointing to signs of stabilization across the country. The U.S. recorded more than 22,000 COVID-19 related deaths, the highest of any other country. President Donald Trump asserted Monday that he is the ultimate decision maker for how and when to relax the nation's social distancing guidelines, as governors from both political parties pushed back, saying the U.S. Constitution gives states the authority to regulate public safety under their jurisdictions. New York Governor Andrew Cuomo, whose state topped 10,000 deaths Monday, said Trump is welcome to tell states when to reopen as long as he has an actual plan.
You want to make those decisions? Tell me you want to make those decisions and then make them in a way that states can follow. Or say, option B, federal government does this, states, you do this.
Meanwhile, Democratic leaders in the Northeast and along the West Coast announced separate state compacts to coordinate their efforts to scale back stay-at-home orders or reopen businesses on their own timetables, even as Trump tried to say it's his call. As officials around the world start to consider how and when to reopen their countries, they worry loosening restrictions could easily reverse progress. Still, there are signs countries are looking in that direction. Spain permitted some workers to return to their jobs, and a hard-hit region of Italy loosened its lockdown restrictions. But the opposite is happening in France. President Emmanuel Macron addressed the nation Monday and extended its strict lockdown. He also spoke of the need to assist African nations. Joining us to talk more about all of this is Paris-based reporter Catherine Field. Catherine, what did President Macron say?
President Macron said that the end is not yet in sight. The threat of the coronavirus is still there, and he announced there'll be a further 4 weeks of lockdown, and that's a very strict lockdown here in France. So that will continue now until the 11th of May. And even beyond that, he said that the lifting of this lockdown would be very progressive, that not everything will open up again come the 11th of May. Restaurants, cafes, museums, they will not open. It will be some time, probably in July, before they will be able to open. Some schools will open, universities will not open, he said. But he said they needed that time within the government to get in place all the safeguards they need. That means more testing, more masks for the population, and also to get the healthcare system really in a secure manner. That means allowing for health workers to have a bit of a holiday, for allowing sort of all the pieces of the French healthcare system to be put back into place, so as if there is the so-called second wave of cases, that France will be ready for this. He did apologize to the nation that mistakes had been made. Initially, there weren't enough masks, but he said that the government took responsibility for it and was now going to make sure that it got everything back on track. He said, indeed, borders will remain closed. So that still means that France is still closed off. Other than from its European neighbours, it's closed off to the rest of the world. He said, yes, this is a reminder of how vulnerable we all are, but there will be joyous days ahead.
Right, and we've seen that cases are continuing to rise in France, so obviously he's looking at it like this is no time to stop what we're doing. But he also has some concerns for Africa. What did he say about that?
Indeed, he made this incredible statement. He made reference to to EU, European solidarity, and the need to support African countries. And in particular, he raised the possibility of either cancelling or cancelling some of their debts. He, of course, said that France did need to help Africa. And when we think about it, France was one of the first G7 nations to step up and suggest financial support. So this was a very important point, but it really did flesh out something that the French foreign minister had alluded to in Parliament here in Paris last Thursday, where he announced that France will reallocate some 1.2 billion euros of African development aid to the fight against coronavirus. And that is part, I think, of President Macron's effort to focus international attention on not just the health and...
That's Paris-based journalist Catherine Field. Meanwhile, the UK will remain in lockdown as coronavirus deaths have risen now above 11,000. Saudi Arabia has extended a nationwide coronavirus curfew indefinitely after cases of infection increased in recent days. The country of about 30 million has recorded more than 50 deaths and over 4,400 infections, including some members of the Saudi royal family. Observers say the numbers are the highest among the 6 Gulf Arab states. Last week, the Saudi-led coalition fighting in neighboring Yemen announced a unilateral ceasefire there. Shortly afterwards, Yemen confirmed its first coronavirus case. Dale Gavlak reports for VOA from Amman.
The Saudi capital Riyadh and other big cities have been placed under a 24-hour curfew to try to stem the spread of the virus. The Saudi health minister has warned there could be 10,000 to 200,000 COVID-19 cases in the kingdom in the coming weeks. Royals have also fallen victim. Prince Faisal bin Bandar bin Abdulaziz Al Saud, the governor of Riyadh, aged in his 70s, is in intensive care for coronavirus, the New York Times reported, citing doctors and hospital communications. King Salman and Crown Prince Mohammed bin Salman, known as MBS, have gone into isolation to avoid the outbreak. Joseph Bahout, a Carnegie Middle East Program Fellow, tells VOA that de facto ruler MBS may see fallout over the kingdom's coronavirus policy.
The very interesting news about the royal family being now directly contaminated. We are talking about something like 150 princes that are already in hospital, and they are preparing some 500 beds to welcome senior members of the family. And this will be, of course, also something that will be put in the liability line of MBS with other things. They have boasted in the beginning that they were dealing with the coronavirus very well, that they were much more equipped than other countries, but now reality is catching up with them.
Health officials in the country believe many of the royal patients became infected abroad. Meanwhile, the Saudi-led coalition backing Yemen's government announced a unilateral 2-week ceasefire in Yemen that went into effect on April 9. Yemen is already suffering through a humanitarian crisis. Gulf analyst Cinzia Bianco of the European Council on Foreign Relations tells VOA there are serious concerns for Yemen's population, already experiencing a lack of food, clean water, medical care, and diseases like cholera, let alone coronavirus now.
There are real concerns in terms of the availability of health resources and whether it is possible at all to do social distancing. So I think it will spread quite quickly, and in 3 months from now we will see a peak level of contagion in Yemen, to the point that it will definitely and necessarily impact also political groups, militias, and everyone who is involved in the war.
The Iranian-backed Houthi Shiite rebels call the Saudi ceasefire a ploy to try to boost its international standing. They accuse the coalition of several attacks the same day the ceasefire was announced. The UN warns that should the virus spread, the impact would be catastrophic. Dale Gavlak for VOA News, Amman.
While children do not represent a large percentage of coronavirus illnesses, the UN says children are emerging as the hidden victims of the pandemic. The United Nations Children's Fund, or UNICEF, says they have found that 99% of the world's children are living with some form of pandemic-related restrictions impacting their well-being. It says virus-related disruptions to children include malnutrition and violence, particularly in vulnerable populations such as refugees and migrants. Joining us to talk about it is Dr. Pia Rebello-Britt, UNICEF Global Chief on Early Childhood Development. Thank you for being with us. Tell us a little bit about what your analysis is finding.
It started with a health pandemic. It's sort of morphing into something so much bigger and much more than we imagined it to be. And so I think that part of it also is sort of taking everyone a little bit by surprise. And as we observe the situation, really, for us as UNICEF, as a global agency where we have programs in about 150 countries, and we also have national committees in about 40 other countries, we are seeing one universal sort of aspect around the world, which is really lives of children have been disrupted completely. And this is regardless of your country income status, regardless of your geography, it is disruption. We see this disruption occurring in urban settlements. We see the same disruption in remote rural villages and refugee camps. It's sort of very broad. Where we are very concerned is first the level of disruption to basic health of young children and families. And we've been doing so much work on life-saving work for young children where, we've really turned the corner on infant and young child mortality. But what we are seeing is that is sort of in jeopardy because a lot of the immunization programs, for example, are not able to reach families in the way they should. So we see from basic health to education, as we know, hundreds of millions of children are out of school right now. We also see tremendous impacts just on basic protection, where children are now more exposed to violence. So, all the areas where children have their basic rights of health, of learning, of development, of protection are all sort of compromised with this pandemic. And within that entire space, we are particularly concerned about the very young children. And initially, because this virus didn't have a clinical impact on very young children or a minimal impact, it was thought that they're not at risk. But as the epidemic grows, actually the secondary impacts for young children are very strong. And at this stage, we really want to raise the visibility on the issue of young children and families. And we are concerned as borders close down and parents lose their job, that these young children may become the hidden victims of this pandemic.
Now, when you say the hidden victims, are you referring to the fact that they're not getting what they need, or they could be in danger of being abused?
Both, actually both. So one, they're not getting what they need. I mean, the thing is that, Laurie, the reason we have all these intervention services is because we know what is needed for young children in impoverished and vulnerable situations to be able to compensate for their life conditions, right? Mm-hmm. And we know that, and now those services are disrupted. They're not there. So that's the first thing, they're not getting that. And then the second point is the one you're raising of their specific vulnerability and maybe heightened violence and abuse that might be taking place at this time, because of the high stress conditions within homes, and then being in that space where they have no alternative, they have no way of being out, they are in lockdown situations. And then we also see around the world where it's going on with sort of detention, migration. So there are a range of situations where their rights are compromised.
Is there any particular part of the world or region that is drawing the most concern for you, or is this more on a general level with younger children?
So it's very interesting. I think in some ways you asked that question because I think the geographies of this virus are very much growing. So this is an interesting pandemic. It started in the global north. And the way this virus is traveling right now, I think what we are concerned about is as it travels to other regions of the world, in South Asia or in parts of Africa, maybe the containment strategies that have been used, for example, in North America or Western Europe may not be possible in those communities. So we are concerned that as it moves to some of these other geographies, that we have the right containment strategies in place, because the basic fabric of life for many of these communities is the social distance model may not work. I mean, they don't have safety nets. Their daily work requires them to get out of the house to feed their family, even to get water. And so we are concerned about the vulnerability. We are concerned about those that live in close proximity, in refugee camps where there isn't running water. So there are these very particular areas that we are concerned about in terms of what we can do to prevent the spread and transmission.
Dr. Pia Rebello-Britt, UNICEF Global Chief on Early childhood development. Cameroon has required the wearing of face masks by all of its citizens and has begun large-scale production of chloroquine to treat COVID-19. The country says its hospitals are already overwhelmed with more than 850 confirmed cases within 6 weeks, yet it does expect confirmed cases to rise into the several thousands. Moki Edwin Kinzeka reports from Yaoundé.
Almost everyone on the streets of Yaoundé began wearing masks Monday. Police were out to enforce the measure taken by the government to limit the spread of COVID-19. 22-year-old Christian Eubin, speaking via a messaging app, says the police forced him to buy and wear a mask.
Temperatures are very high, up to 35 degrees, and they are asking us to wear masks, which suffocates us. And I think the best thing to do is to respect social distances, stay far from people.
Dr. George Alain Etunimbala, Director of Pandemics and Epidemics at Cameroon's Public Health Ministry, says they are insisting on preventive measures because hospitals are already being overwhelmed by the number of COVID-infected persons.
On va libérer des listes, c'est-à-dire faire sortir des malades dans les hôpitaux qui n'ont pas besoin de traitement.
He says with the ever-growing number of infected persons, the government has asked people who are feeling better in hospitals, including COVID-19 patients, to return to their homes, where they will have medical follow-up by hospital staff. He says the government is also transforming football stadiums and gymnasiums into facilities where COVID-19 infected persons will be received for treatment. Madeleine Chuente, Cameroon's Minister of Scientific Research and Innovation, says besides the obligatory wearing of masks, the government has ordered the production of the drug chloroquine to treat COVID-19 patients. She says they have started producing 6,000 tablets per day and expect to drastically increase production when they get some more ingredients from China. She says President Paul Biya has ordered them to produce at least 8 million tablets of chloroquine each day as the situation is getting worse. She says Cameroon has the know-how and laboratories to produce the chloroquine, but what they lack are the necessary active pharmaceutical ingredients they can import from China and India, and that China has assured Cameroon that the ingredients will be shipped in 2 weeks. Chloroquine is one of the oldest and best-known anti-malarial drugs. It has also attracted attention over the past few decades as a potential antiviral agent. Last week, Cameroon announced that it had seized counterfeit chloroquine from at least 300 pharmacies and hospitals and closed 2 fake pharmaceutical companies as thousands of its citizens were rushing for the drug with unproven belief that it can stop COVID-19 infections. Emmanuel Anyangwe Ngassa, a Cameroon-born medical doctor practicing in Germany, says U.S. President Donald Trump is leading many African countries to believe there is a cure for COVID-19 when scientists have not yet announced any. He spoke via a messaging app from Bonn.
What is the essence of that drug? Chloroquine has not been proven to treat COVID-19 successfully. It was unfortunate that Donald Trump took this thing up, spoke about it, and publicized it.
The rush for chloroquine as a treatment to COVID-19 began in Cameroon in March after France announced that half of 14 patients who underwent chloroquine therapy got better, and when U.S. President Donald Trump referred to it as a potential cure for the ravaging coronavirus disease. Moki Edwin Kinzeka for VOA News, Yaoundé.
Here are some of the other top stories we are following. A member of the crew of the coronavirus-infected USS Theodore Roosevelt died Monday of complications related to the virus. The death came 11 days after the aircraft carrier's captain was fired for pressing his concerns that the Navy had done too little to safeguard his crew. The sailor was the first active duty military member to die of COVID-19. On top of the pandemic, the U.S. Southeast is dealing with more misery after a dangerous storm plowed through, killing more than 30 people on Monday. The storm brought tornadoes, flooding, and mudslides and left more than 1 million homes and businesses without power. South Korea reported Monday that at least 116 people initially cleared of the new coronavirus had tested positive again, even as officials suggested they would soon look at easing strict recommendations aimed at preventing new outbreaks. South Korea reported only 25 new cases overall Monday, but the rise in reactivated patients has raised alarm. Stay with VOA for all the latest on the coronavirus pandemic.